Okay, now we move on to the future session. All right? Okay, we'll co-chair this session. I'm Toru Takebayashi, currently serving as the chairperson of the board of directors of the JSOH, and
I'm Etsuko Yoshikawa, an associate professor of Japanese Red Cross College of Nursing.
so it's my great pleasure to introduce Professor Akihito Shimazu. He's going to talk on the promoting workplace, mental health, and well-being. Please.
Yeah, good morning, everyone. Thank you very much for your kind introduction. I'm Akihito Shimazu, working for K University and former chair of ICO-OOP's work organization and the psychosocial factor at work. And today I'll talk about the promoting workplace, mental health, and well-being. Yeah, to start my presentation, let me show the definition of mental health. According to WHO, mental health is defined as a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well, and work well, and contribute to their community. As you can find, this definition covers various broad aspects of mental health. From a negative aspect of mental health, such as reducing stress, anxiety, depression, and anger, and so on. And the more positive one, how to improve more well-being. Of course, the traditional occupational mental health focus mainly on how to reduce stress, negative aspect of mental health. And however, the problem is that, this is very important to reduce negative aspect because a negative experience of mental health is very, very, important and unfavorable and uncomfortable for us and impair our working life. But also it is also important to improve more positive experience is important because to improve for our total workers' well-being. So this is a conceptual framework of healthy worker. And this framework consists of two axes. One axis is ill health axis, and the other one is performance axis. Traditional occupational mental health mainly focus on these ill health axes and pay more attention to how to reduce ill health and stress. And this is important, but and even if we reduce ill health and we are absent from stress, some workers can be lower motivated, leading to low performance. So the important point is how to achieve health and performance. In other words, collaboration between health sector and non-health sector is important. So in my presentation, in the following presentation, I focus on work engagement to bridge these two axes, health sector and non-health sector. And this is the definition of work engagement, which is defined as a positive, fulfilling work-related state of mind that is characterized by vigor, dedication, and absorption. And vigor refers to high levels of energy and mental flexibility, and dedication means strong involvement in one's work, and finally, absorption refers to the present state of total immersion in one's work. And there are several factors behind growing attention to work engagement. First is about the changes in the labor market. With a shrinking workforce due to declining birth rate and aging population, it is increasingly important for individuals to work in a healthy and fulfilling manner. And the second one is about intensifying competition among companies. To remain competitive, companies must go beyond merely improving work efficiency. They need to foster employees' proactivity and creativity. And finally, changes in the nature of work. Routine and repetitive tasks are decreasing, while jobs that require creativity and imagination are on the rise. So, given that background and circumstances, enhancing work engagement and promoting decent work taken up as one of three main agenda of discussion points at the G7 Classic Labor and Employment Ministers meeting in Okayama 2 years ago. So you can find the final declaration of ministers on the website, and you can download this, the final declaration from the website. So now let's move to the empirical studies. According to the observational studies, work engagement is associated with better health, such as low level of depression, low level of anxiety, less psychological distress, better sleep quality, low high sensitivity CRP. And very interestingly, work engagement is related to higher partner's happiness and lower child's difficulties. And the work engagement is also associated with better performance, such as higher overall job performance, higher employee performance and customer loyalty, and the daily financial returns, and the lack of registered sickness absenteeism, and higher in-role performance and extra-role performance, such as creative behavior. And very interestingly, work engagement is associated with followers' high performance and lower turnover intention. So here our question is how to improve work engagement. The first step to answer this question is to share the conceptual framework together with various stakeholders such as occupational health staff, employers, human resource management, managers, and workers. This figure shows the theoretical model called as job demand resources model. This model consists of two processes, health impairment process and motivational processes. The traditional occupational mental health focuses on these health impairment stresses, starting with job demand. This is a source of stress, leading to stress responses and resulting in adverse health and organizational outcomes. On the other hand, positive mental health focusing on motivational processes, starting with personal resources, job resources, leading to work engagement and resulting more good health and organization outcomes. And importantly, focusing on personal resources and job resources is important because it improves work engagement, but also decrease stress responses. Okay, so when we conduct the intervention strategies, we need to adapt multi-level approaches, which covers organization, team, individuals, which is recommended. And very importantly, employees are nested in teams, which in turn are nested in organization. So it is very important to government support. Yeah, for instance, Japan's government provide investing human capital, work style reform, stress checkup and certification and award system, and so on. And here is some example how to improve work engagement, focusing on job design. And this is a positive approach to the workplace. And this positive approach consists of survey, feedback, participatory workshop, and implementation and monitoring. Yes, and through these processes, each workplace finds their own strengths at workplace and improve the strengths at workplace. This is a program manual, and you can download the PDF from the website, but it is only in Japanese, sorry. And the next one is focusing on the organizational climate, named as CREW, Civility, Respect, and Engagement in the Workplace. This CREW program aims at improving the work climate through more civil and respectable interactions from good workplace into great workplace. And in this program, small groups meet to discuss issues that affect their daily work towards respectful environment at work, weekly or bi-weekly for 6 months. And each session has 30 minutes, and the trained on-site facilitator runs a session and meeting. And finally, this is the program focusing on improving personal resources, specifically job crafting, which is defined as physical and cognitive changes that the individual make in their task and relative boundaries. This program has 2 sessions. Each session has 90 minutes, and yes, and this is a picture of the sessions, and we also have the training manual. And now conclusion. First, there are accumulating empirical researches of work engagement as an indicator of occupational post-mental health. And the second, work engagement is associated with better health and performance. And work engagement is also associated with well-being of one's colleagues and family members. And finally, small but positive effects of interventions are observed. So longer-term effects and the moderators of intervention effect need to be clarified. Yes, thank you very much for your attention.
Thank you. Thank you for your interesting lecture, and then more focus on the positive side of the psychological aspect. So now let's move on to the second speaker, the Professor Tomohisa Nagata. He's going to talk on the policy, the practice of health and productivity. Please.
Good morning, everyone. Thank you, Toru and EXPO, for chairing this meeting. Today's topic is the policy and practice of health and productivity management in Japan. So today I want to introduce this topic and explain the challenge for the future. This figure shows the population trend in Japan. You know that Japan is population is decreasing, especially rapid decrease of the working age population. This trend related to economic downturn and related to difficulty in maintaining social security system, such as medical care and pension. In this situation, the Japanese government implemented Japan revitalization strategy in 2012, extending the nation's health life expectation became one of the themes of the strategy. The Japanese government aimed to maintain working population. Second, to improve financial condition of health insured. And third, to develop healthcare industry through health promotion effort for citizens. In the perspective of employers and employees in the workplace, a health and productivity management initiative, HPM initiative, has started in 2014. This figure shows the pathway envisioned for HPM initiative. In the starting point, corporations invest in their employees' health, and then employees will be healthy, and team will enhance productivity, and company will be known as excellent and to improve corporate image. HPM initiative led by the Ministry of Economy, Trade and Industry, METI, not the Ministry of Health, Labor and Welfare. This is the interesting point. recognition program, HPM selection by the Tokyo Stock Exchange starting in 2015 just among listed companies. And excellent cooperation in HPM started in 2017 among large companies, including not only a listed company, but also non-listed company. This left figure shows the award ceremony. Many chief executive officers participate in award ceremony. The right figure is the number of applicant company is increasing year by year in the large corporation sector like this. About the evaluation method of HPM practice, the self-administered questionnaire called HPM survey sheet used for recognition evaluation consists of about 80 questions focusing on 4 areas. First area is the management philosophy and policy. Second, organizational structure. Third, system and measure implementation. And fourth is evaluation and improvement. Overall score was calculated with rating of each area, 3 on 2 on 2 on 3, like this red formula. Compliance and risk management, including occupational safety and health, serve as a prerequisite for recognition. About an evaluation result. Evaluation result returned to the company with a feedback sheet. The feedback sheet consists of the comparison with benchmarking, strong point and weak point, recommendation for improvement, and trend to scores. To use this feedback sheet, the company can improve their activity. The evaluation results are also freely open access to public, including investors and shareholders. Anyone can download the scores from the website as an Excel file like this. This is the company name and the score, overall score and the dimension score, like this. This recognition program is implemented not only in large corporation sector, but also in small and medium-sized corporation sector. We conducted a study in excellent cooperation in HPM in small and medium-sized enterprises. The purpose of this study is to reveal employers' perspective of motivation, barriers, and effectiveness of HPM. Motivation to apply the certified HPM is 70% employers answered improvement of a company image. A barrier to implement HPM is not knowing and difficulty in how to get employees involved in each healthcare activities, 64%. Finally, the effectiveness of implementing HPM, improve employee lifestyle and enhance their health literacy, 56%, and increase employee awareness of safety, 40%, competitiveness in recruiting human resources, 33%, like this. So I talk about the challenge for the future. In a nutshell, quantity and quality. About quantity, this figure shows the applicant company increasing year by year in small and medium-sized corporation sector, but this number is only 0.5% of small and medium enterprises. In contrast, the number of applicant companies exceeds 70% of listed company, a large company. So it is a different situation. In Japan, 99.6% are small and medium-sized enterprises, and about 60% of people work in the small and medium-sized enterprises. about quality. Our researcher conducted many study. For example, the left figure shows that the stock price of the selected 22 companies of HPM, the red figure, like this. This stock price is higher than the average. For example, the topic, Tokyo Stock Price Index, so the good performance. But this is just a correlation, not the causality. So our researcher have to conduct research to reveal and access to the causality to the good performance. Improve the quality, the government developed an HPM guidebook for employers. The guidebook consists of the, for example, description of how to implement a PDCA cycle, sharing the good practices, and the key concept is health climate. Health climate promotes participation of employees in health promotion, and then lead to the employee's behavior and then employee's health. This health climate related to safety climate. Safety climate promotes safety awareness of employees and then decrease occupational injuries and illness. This climate is a very similar concept of the organizational climate. Organizational climate improves corporate image and then increase in job applicants, like this. So that is the summary. Thank you for attention.
Thank you, Professor Nagata. He will describe our challenge to the occupational health in small enterprises.
Okay, shall we move next presentation? The Professor Seiichiro Tateishi. Today, he'd like to give a presentation about disaster occupational health. Okay, so please start your presentation.
Good morning, everyone. My name is Seiichiro Tateishi from University of Occupational and Environmental Health, Japan. It is a great honor to have this opportunity to greet at the GISHW Symposium, a premier global gathering for occupational health and safety, and to share Japanese experience in disease occupational health. The world is experiencing a major era of crisis due to climate change and pandemics, putting workers at the forefront of response efforts. In Japan, there is an ongoing shortage of occupational health resources, especially in small, medium enterprises and local governments, which poses a great risk during crisis. I will discuss lessons from Japanese experience and share recommendations for the international committees. Disaster responses success hinges on peacetime preparedness, which is fundamental to disaster occupational health. Companies should embed employee safety in their business continuity plan, BCP, and create a dedicated occupational health BCP, conducting through risk assessment across physical, chemical, biological, ergonomics, and psychosocial areas is key. Stockpiling medical supplies and training all employees in psychological first aid, PFA, are also vital steps. After disaster strikes, the first 72 hours are an extremely critical period that determines the life and health of employees. During this period, tasks such as safety confirmation, first aid, sanitation measures, and psychological first aid are considered critical duties in fulfilling a company's legal obligation to care for employees. It is the responsibility of modern employees to establish a responsible management system in peacetime to ensure these tasks can be carried out under any circumstances. In the recovery and reconstruction phase, long-term responses to issues such as overwork and PTSD are also required. Now I would like to introduce two specific case studies from Japan. The first is the 2011 Great East Japan East earthquake and the first is the 2011 Great East Japan earthquake and the subsequent Fukushima Daiichi nuclear power plant accident. Workers engaged in recovery efforts were required to wear full-body protective suits like this to prevent radiation exposure. However, this gear severely hindered heat dissipation, dramatically increasing the risk of heat stroke during the summer. Furthermore, more than 3,000 people worked at that site daily. Within a multi-layered substructure link structure involving over 500 companies. This complex management system made it extremely difficult to ensure that safety and health management reached every single worker at the ground level. In response to this challenge, our team took a systematic evidence-based approach. First, through on-site surveys, we identified a lack of knowledge about heat stroke. Based on these findings, we proposed 8 concrete measures, including shortening work hours and using cool vest. We then collaborated with the Ministry of Health, Labor and Welfare to build a support system. Our on-site recommendations were also reflected in the official government guidelines. As a result, the number of heat stroke cases dropped from 21 in July to just 4 in August after our measures were implemented. And there were no severe cases or deaths throughout the summer. The second case is the Noto Peninsula earthquake in 2024. In this earthquake, in addition to load disruption and a seriously aging population, the overtime and mental health of the local government officials who were leading the response became an extremely serious problem. We adopted a new technology-driven system to better support our supporters. We used the J-Speed smartphone apps so officials in affected municipalities could report their daily health status remotely. During the operation period, there was a total of 5,509 entries, and our expert team, Disaster Occupational Health Assistance Team, DOHAT, analyzed this data in real time. We then operated a health management cycle, identified high-risk individuals, and connected them to 283 individual interventions, such as telephone interviews and referrals to specialists. Furthermore, based on this objective data, we are able to propose concrete organizational implement to municipal managers, such as ensure rest periods for staff and reducing the number of meetings. The challenges revealed by two Japanese cases, such as delays in measures for SMEs, the protection of valuable workers, including non-regular workers, and risk management across the entire supply chain are by no measures unique to Japan. We recognize them as global challenges common to many countries. Therefore, today I would like to offer 3 recommendations. First, a simple international guideline codes. Second, strengthen a platform for knowledge sharing the technology like JSpeed. Third, advanced interdisciplinary research and practical cooperation. Disaster occupational health is not merely a management activities. It is a fundamental human right and a core component of decent work. Building back better from a disaster can only be achieved on the foundation of the safety and health of all the people who support our society. Thank you for your attention.
Thank you very much, Professor Tateishi. Japan is disaster-prone country. It's very importance of the disaster occupational health, protecting workers' health and safety during disaster occurs. Thank you very much for your useful presentation. So we will introduce the final speaker of these sessions, Professor Koji Mori. As a former president of JSOH, he'd like to introduce about training of occupational health professionals. So please go ahead.
Thank you very much for the introduction. I would like to discuss our effort for human resource development in Japan and Asia. First, let's talk about the fundamental aspect of developing occupational health professionals who can function within a multidisciplinary collaboration model. Then I will discuss 2 challenges. So the Japan Society for Occupational Health is a large academic society with over 9,100 members from various professional backgrounds. We are organized into 9 regional chapters and 4 professional activity groups. Additionally, we have 30 thematic study groups and hold 2 national academic conferences in a year. Members have numerous opportunities to share knowledge. JSOH played a key role in developing occupational health professionals in Japan, offering training and certification mainly for occupational physicians and occupational health nurses. Specialist occupational physician must first earn a social medicine specialty, complete 1 to 2 years supervised training, and pass the exam. Since 1993, 681 specialist occupational physicians have been certified. Specialist occupational health nurses must pass a written exam, register, complete supervised training, and pass an oral exam, including those certified in the first year by experience. 628 specialists have been certified. However, these numbers are not enough to meet national demand. Now let's move on to our new challenges and strengths for developing human resources in occupational health in Japan. Legal qualification requirements of the occupational health professionals are minimum in Japan, and the numerous of comprehensive trained occupational physicians and occupational nurses is insufficient. Technological innovation and an aging workforce necessitate a shift toward shift-managed occupational health from the regulation-based occupational health and advanced level expertise. So developing highly skilled multidisciplinary professionals requires time and sustained effort. So our first challenge is enhancing basic specialists via advanced expertise and multidisciplinary model. This involves developing advanced expertise in occupational health and constructing and presenting multidisciplinary collaboration model for self-managed occupational health. We also aim to contribute to diverse human resource development opportunities for basic specialists involved in occupational health in collaboration with other related organizations. Regarding diverse human resource development opportunities for occupational physicians, employers in Japan must appoint an occupational physician for workplace with 50 or more workers, chosen from doctors who have completed at least 50-hour training. Most of them participate in a certification program by Japan Medical Association, JMA. Now, the JSOH has formed a joint council with JMA to support prefectural medical association in planning and implementing renewal training. For occupational health nurses who are not legally required to be appointed, they play a key role in workplace health promotion. Currently, there isn't a regular training program at the start of their career. However, a fundamental training program led by JSOH members is being developed for implementation in fiscal year 2026 as part of the continuing education. For occupational hygienists, continuing professional development training programs have been provided at our annual conference, and offer other opportunities. The Occupational Hygiene and Ergonomic Group has contributed to the training and development of certified occupational hygienists in collaboration with the Association of Working Environmental Measurement. So, and finally, the occupational dentist. Their role includes the prevention of occupational dental diseases and the promotion of oral health. An introductory e-learning course on occupational dental health is jointly delivered with the Japan Oral Association, a dental association, to help dentists nationwide understand workplace health management. Now, I would like to shift our focus to collaboration with Asian countries. Japan has valuable experience to share. We have addressed evolving work health issues in response to industrial structure changes as we presented the previous session. We believe Japan's experience is effective for worker health issues, which are simultaneously emerging in other Asian countries. Our second strategy is contributing to the development of occupational health professionals in Asian countries. By sharing our experience, we can contribute to problem solving and the development of specialized human resources in Asian countries. We aim to collaborate with relevant societies and professional organizations in Asia, such as Asian Conference on Occupational Health and the Asian Network of Occupational Hygiene. To facilitate this, we have established a platform by appointing a director in charge of international affairs and setting up international business working group to examine business expansion. We actively collaborate with the Asian Conference on Occupational Health and the Asian Network of Occupational Hygiene and the Japan, China, Korea Occupational Health Conferences. For networking, we encourage participants from Asia by setting up an international session at our annual meeting. For example, in 2023, we welcomed the participant from Vietnam. In 2024, participants from Indonesia, Thailand, China, and Taiwan we have, and into 2025 from Indonesia, Thailand, and Korea. We are also promoting joint research with Asian researchers through initiatives like the Occupational Health for SDGs Research Developing Project in Asia, run from the May 2023 to February 2026. The initiative includes a health survey and occupational health management of Mongolian mine workers, promoting mental health among nurses in distinct hospitals in Vietnam and Thailand, and initial development and evaluation of facilitator training for participatory workplace improvement in Asia. The International Business Working Group is actively discussing further development in this region. In conclusion, I would like to reiterate our two key messages. Strategy 1, strategic training and certification system strengthens Japan's capacity for self-managed occupational health. Multidisciplinary collaboration models are key to developing advanced specialists and enhancing basic occupational health researches. Strategy 2, sharing Japan's experience support capacity building and problem solving in Asian countries. Joint research and academic exchange foster sustainable growth in the region's occupational health human resources. Thank you very much for your attention.
So thank you very much for excellent presentation. So the characteristics of JSOH consists of multidisciplinary professional. So they take advantage of this merit. So it is expected to spread these experiences, not only Japan, but also Asian countries. So thank you very much. So we successfully keep 15 minutes for discussions. So now we open the floor. If any question or comment about these 4 presentations, please raise your hand. Okay, please.
Good morning. My name is Millie. I am from South Africa, the Ministry of Employment and Labour responsible for health and safety. Thank you for the informative presentations. Just on the presentation related to occupational health in times of crisis, just wanted to find out, how do you determine the crisis? Do you do risk assessments? Do you have different scenarios during that particular time? Because we had floods in South Africa last year, and where we had some people that unfortunately passed away. So you can't normally determine, especially when it comes to weather patterns, etc. So how do you do it? Do you do risk assessments in advance? Do you do modeling so that you are able to look at the health of the workers? Thank you.
Thank you very much. So the Professor Tadeishi.
すごい難しいので日本語でいいですか？あ、失礼しました。英語で翻訳してくれるので。あ、わかりました。あ、はい、ゆっくり。あ、はい、サンキュー。すごく日本でも難しい問題でして、日本では健康面に関してとその災害が起こった時のその初動の安全というのはまたちょっと別の部門がこう対応していることが基本になっています。で、災害が発生した時に健康面というような面においてはオキュペーショナルヘルスが今初めて東日本大震災の2011年に出てきた時から動き始めたというようなところで、まだ具体的にやれていることというのは物理的な因子の熱中症に対することとかメンタルヘルスに関すること、あと生物学的な問題に関すること、これくらいに関しては今やっと守備範囲として広げることができているようなところになっています。ただ私たちのこれまでの経験でもまだまだ足りないと思っていることがあって、日本の中でも例えば日本の中でいまだに建材がアスベストがたくさん含まれているようなものがあったりとかするのですが、このアスベストに関して、評価もなかなかする災害が起こった時に評価もすることができないので、どれくらい暴露した人がいるかっていうことも、現時点では分かっていないというような状況になっています。そして化学物質の災害が起こった時というのもどれくらい暴露があるかというのもあまり評価しないままにケアしなければいけないというような状況というのがまだまだ残っていて、私たち自身もまだ手探りでやっているようなところになっています。一方でアメリカなどに関しましてはインシデントコマンドシステムというようなものがあってきちんと定型的に対応するというような、そのようなシステムがかなり整っているような国もあるので、そのような先進的な事例等をある程度私たちの日本の方でも引き継ぎながら少しずつ拡充していきたいというふうに思っております。大変重要なご指摘だというふうに思いました。ありがとうございました。
Thank you very much. So, Dr. Tsurugi, if you have additional comment about risk assessment of disaster situations.
I'm working for the how to say, occupational health issues for the public employees in Japan about risk assessment during disaster situation. Especially for the public employees in Japan, they must work in front line when once disaster occurred. So and the public employees need to manage the disaster issues. Residents first. Residents, people in the community is most important to rescue. So they don't think about their own health matters during disaster occasions. So they're easily overworked during disaster occasions. So how to say, when once a disaster occurred, I'm working as an occupational physician in my office. I try to assess their health condition as soon as possible, and if they seems to be overworked, we try to let them take rest, and we try to make a environment that they can take rest. Is that okay?
Thank you very much. Thank you very much. So any other question or comment? Thank you. Professor Tsutsumi.
I will talk because there is frozen again. So, but I'm wondering that strategy of societies to the Asian countries. So maybe yes, we are collaborating Asian countries, and also maybe expand our experience to other countries. Do you have plan to have something to expand the collaboration to the other countries or something?
So maybe I'm not the right person to say the additional strategy because I just designed the president position. Maybe the Professor Takebayashi say something, but so maybe we had a good collaboration with the Asian country. So now we should focus on the Asia and sharing the information. So other, but so. From Asia, we can contribute to the, give the information to the other countries like Africa and other region. However, we know the situation of the Asian country well, and we can easily discussing what we should do. But we should know the real situation in the other region if we will collaborate with. So this is the correct mindset of mine. So do you have any?
Well, we think we are facing so rapidly changing the society. And the first is we face the aged population, which means the reduction in the population size. It's more need to focus on the multidisciplinary approach to the occupational health issues as well. And then the work style is changing so rapidly. So we need to more focus on the small enterprises, not only small enterprises, but also the more independent type of work like a freelancer. So, but on the other hand, Japan has the more the participatory approach is very common to all the workplaces. So we more focus on that side for our future. And we also share the experience for the Asian countries. But also we face to the so rapid climate change like a disaster occupational health. So maybe for the next few decade, we will focus on the so-called planetary health approach, like all the issues for the environment and also the One Health approach, like the prevention of the infectious disease. So we need to more share our experiences and other Asian countries' condition and to promote all the occupational health professionals to share our experiences and then see the common vision for the future of occupational health, I think. Thank you.
Hi everyone, my name is Miriam. I'm from Germany. Thank you so much for everyone's presentation. And I was wondering, looking back on the COVID pandemic, there are programs, for future pandemic preparedness, but I feel looking at Germany, I don't know if we're so well prepared. And I was wondering if Japan has any programs in place how to handle maybe future pandemics. Thank you so much.
Thank you very much for very useful questions. So the JSOH team members conducting the research project prepare the next pandemics. So at the result of this research project, we are developing some educational training, like risk assessment, how to improve the risk assessment of the new pandemic in the workplace. So now we are released to that program in the website. But sorry, that is the Japanese language only. So now we are prepare that some guidelines and the training program for the next pandemic. So that is the short information. Thank you very much. Thank you. So any other questions? Okay.
Good morning. Thank you very much for your wonderful presentations. My name is Fortunate. I come from the Kingdom of Eswatini in the southern part of Africa. My interest is in the health and productivity management. I think the presenter highlighted the issues of SMEs and the large enterprises, and that's also my interest. We have just launched a national workplace wellness policy. So I just want to ask the experience of Japan, because you stated that you have a challenge with this health and productivity management being embraced by the SMEs. So what is maybe the way forward? How do you intend to overcome this challenge, so that I will also maybe benefit, as my country is also SME driven economy? That's my question.
Okay, thank you very much. So Professor Nagata, Dr. Nagata.
Thank you very much for the question. Now the Japanese population trend is degrading, and the economic situation is shrinking. That situation is much to the implement health and productivity management. But in Japan, it is difficult to enhance and implement the HPM initiative in small and medium-sized enterprises. And at that, in the previous study, about 50% employee don't know this initiative, but half of the employer know this initiative. So in Japan, for the future, we have to conduct a PR using the newspaper or the other media to implement in the HPM initiative. How to enhance and implement the HPM initiative? I think it is difficult to say, because the economic situation and is different country by country. So in your country, in my opinion, you have to redevelop and redesign the HPM initiative, I think. It's my opinion. Thanks so much.
Thank you very much. So time has come, so I'd like to close this session. Thank you very much for your cooperation. So to give a big hand to for speaker, thank you very much.